The governor and his task force unveiled the state's new plans today to reduce the death toll directly related to opioid addiction. WGBH's Adam Riley has more.
There were two big takeaways from today's anti-opioid event at the State House. Number one, this is the rare issue that transcends partisan politics.
Here in Massachusetts, last year in 2014, 3 times as many people died of opioid overdoses as died in automobile accidents.
We are not going to arrest or incarcerate our way out of this. This is a disease. This is a public health crisis, and we must treat it and address it as such.
And here's a second takeaway. The opioid problem in Massachusetts is so complex and so severe that there's no simple solution. The action plan unveiled today includes more than 50 separate proposals, from timelier reporting of overdoses to better monitoring of physicians to changing the way people think about addiction.
We have got to be open-minded in how we think about this and not assume there's a big silver bullet out there somewhere.
Now, as with most big ideas on Beacon Hill, there is a price tag. Implementing the various proposals we heard about today will cost around $27 million. Governor Baker didn't say exactly where that money would come from, but he insisted that getting it won't be a problem.
We'll figure it out. I mean, with $27 million and a $40 billion budget, $38 billion, we'll figure it out.
And afterward, it was that sense of determination more than any specific policy points that had people buzzing.
10 years ago, when I started advocating on this issue, I couldn't get an elected official to say the word heroin.
The change in administration, Governor Patrick, great. This governor also, along with the Attorney General and the Mayor of Boston, are all looking at recovery, addiction, prevention, and how we keep our folks out of harm's way.
Adam Riley, WGBH News.
Joining me now for more on this are 3 of the 18 members of the task force. Marylou Sudders is the governor's head of Health and Human Services. Dr. Sarah Wakeman is the medical director for substance abuse disorders at Mass General Hospital. Steve Tolman is president of the Massachusetts AFL-CIO. Thank you, all 3 of you, for coming. 65 steps, Secretary Sudders, I read. What are the most important, what are the game changers that people would get?
So I think the most important game changer is that we need to see substance use as an illness, that this is a public health crisis.
This is public safety.
Not public safety, public health, and we need to treat it as a chronic medical condition, and we need to focus on public awareness, education, intervention, treatment, and recovery, the entire spectrum.
I want to talk about education with you, Steve Tolman. You were recognized by the governor today as someone who, quote, first person to start talking about this in a serious way back in the 90s. Why'd you care about this?
Well, I saw the devastation. I talked to the moms and dads. I saw the young kids who just got pain medication before they know it. They were sniffing heroin, and then they were shooting heroin. It evolved. They had no idea. And you saw the heartache in the households, and so from one thing leads to another.
You know, when I hear about this public education component, intellectually, I'm always right there. But then I say to myself, what kid does not know the dangers of taking too much of an opioid or anything else? I mean, we're really going to teach something that they don't understand already?
Well, I tell you what you will teach, that there are consequences to misuse and medication. And the problem is that these kids in the last 15 years, when OxyContin came out, they said it was fine, not addictive, the best thing since sliced bread. People believed it, Jim, and they took it. But what happens is it almost changes your brain immediately, and it is far too powerful. It is too powerful for the human brain, and that's what it does. It actually controls the person. It hijacks them.
You buy this notion that kids particularly, I mean the invincibles as they're called in so many ways, are going to hear that message and say, aha, boy, this is really dangerous.
Well, I think, you know, there are evidence-based prevention strategies that I think we have to implement. But to Steve's point, I think kids don't realize that these pills are going to lead to heroin. I think no patient that I see ever thought that they would become a heroin addict. And so we know that kids are now experimenting with pills the way they used to experiment with marijuana or alcohol. And then again, these brain changes happen and this disease develops and people go on to using heroin and doing things they never thought.
Doctor, I had coffee the other day with a pretty prominent person in town who said to me he's very concerned about what you guys are doing, even though he supports the general direction, because without these kinds of drugs, his wife would not have been able to survive the kind of pain. Aren't some of these regulations and rules and licensure deals, aren't they going to cause some doctors to say, I don't even want to deal with this?
Yeah, I think that's a fabulous question. I think we were very aware of that on the task force. We had representation from the pain world, the pain advocacy world, and I think we thought about that a lot. You heard the governor say that today, that these medications really are life-saving and quality of life-saving for some patients. So I think you have to have a balanced approach, that in the 90s we swung too far to this, you know, opioids are great for everyone, and we don't want to swing to an opioid phobic where no one will prescribe them, but having, I think, think structure, guidance, and helping doctors feel safe and supported that they can do this in a smart way.
How did this explode like it did? Why did this go from troubling to an epidemic?
Well, first of all, we now know that 3 times more people have died from opioid-related deaths than car accidents in the Commonwealth. And honestly, I think when it really hit the white middle class, it just exploded. And I want to go back to the comment around education, because we need to really, we've heard from families, from parents, they didn't realize how potent these medications are, and that they have absolutely, they have positive therapeutic effects, but they can be absolutely devastating and addictive. And so part of the education is really targeting parents. So when your kids sign up for athletics, part of that's going to be having you understand what the positive and negative uses are of opioids.
It was athletics that got the governor interested in this, wasn't it? Because of his son who was taking some
2 things.
pain medication.
One was his son who broke his arm. The other is the governor was campaigning. As he said, this really was not on his screen, and everywhere he went, someone talked about it.
The governor was asked in that little piece we just saw by somebody, is 27, we're going to get to $27 million. Let's assume he finds the $27 million, which I'm sure he will if he says he will. Is that enough? Are there enough beds in this plan? Is this bold enough to really solve is a horrible choice of words, to address the problem?
I think the $27 million and the 55 recommendations starts to turn the curve. There's no question that we will start to trend this in the right direction. It has to be multifaceted, multi-pronged education, intervention, treatment.
What makes you most nervous about the potential success of this thing, doctor?
The potential success?
Yeah,
Well,
I mean, when you say to yourself, we're on the right track, as the secretary said, what causes you to worry most that maybe you'll get derailed along the way here?
Well, I think we have a long history in this country of approaching addiction in a certain way. We've criminalized it as a social failing, or lack of willpower, or something that deserves incarceration. And so really to rethink of this as a disease is a really bold thing. It's much bigger than I think people are realizing. And so I think to really shift the treatment system to match how we treat every other medical condition is sort of our goal here on the working group.
If you weren't part of a task force, but the governor had appointed you the czar of this issue, in light of the fact that he acknowledged you've been at this longer than about 20-some years, would you have done what the 18 of you did, or would you have done something differently?
Well, we had several debates, Jim. So and we had
Which ones did you lose? I'm serious about that.
No, I mean, I'm more of an abstinence. I think that we should be striving for abstinence, and I think we tend to use the medications a little too quick, because I'm not so sure. I mean, but I respect the concept that we all agree there's not a one-size-fits-all, but these are young people who get hooked on a prescription drug, and by and large, I think their bodies are strong enough and they can beat this drug and get off it. And I'm not a fan of using supplemental medications.
Is he naive about abstinence, either of you two? Is he naive about that?
No, I'm not sold totally. Yeah. I'm saying that should be what we strive for. Because I think the medication should be kind of a last resort. That's just, now I know it works, but you've got to get them off it. You have to have exit plans, and that's one area where we struggle.
I think where we've come down is that people with addictions are not a homogeneous group.
Right.
We need all the tools in the toolkit, and we need to balance abstinence, medication-assisted treatment, and the like.
Before you go, since you are the secretary, I hear we did a report the other night, Adam Riley did, on Brockton, this medical marijuana dispensary actually may happen 2.5 years after the public spoke. This is finally about to happen?
Yes, it is finally about to happen any day now.
Salem is number one?
Salem is number one.
And Brockton soon thereafter?
Brockton soon thereafter.
And how soon are we going to have as many as the law mandated?
As truly, the obstacles that the Commonwealth had created have been removed. So now it's a licensing process, just like we license pharmacies.
Secretary Sudders, good luck on all this.
Thank you. I take all the good luck I can get.
Dr. Wakeman, good to see you.
Thank
Steve
you.
Tolman, pleasure, as always. Thanks to you all.